Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. My guest right now is Sarah Nicholson with Babyscripts. Sarah, great to see you.
So glad to be here.
So I love what you're doing. I've been following the team and the company for many years now. The whole time I've been at Startup Health and watched the way that you have helped expectant moms have healthier pregnancies and even avoid unnecessary trips to the OB when it's expensive or it's a hassle. So I love what you're doing. Give me a kind of a flyover of where the Babyscripts platform stands right now, what you're offering.
So traditionally, we were really focused on clinical risk factors, particularly around blood pressure and detecting preeclampsia. As we've grown and seen more and more about the poor outcomes around maternal death, we're seeing that behavioral and social issues are becoming more and more prominent in maternal health outcomes. So we really wanted to think about how we can address those issues in our platform and identify risk factors that are not just clinical, but also social, behavioral health, and things of that matter, so that we can incorporate different stakeholders to be able to address those different risk factors.
Okay. What are some practical ways that you incorporated those into the platform? What kinds of surveying, what kind of tools are you employing?
We have a lot of opportunities through surveys, checklists, assessments for women to be able to self-identify risk through whether it's pregnancy history, mental health. We specifically released a product called My Mental Health, where we deliver assessments through prenatal and postpartum. This is the Edinburgh postpartum depression screening, the PQ9, and different assessments where we can identify that risk, and then we use a trigger protocol to be able to alert a provider if there is risk around mental health. We've been able to do research on that product. We recently published an abstract at ACOG that showed that we had 4 times that women were taking the survey 4 times more than they were in the office in the prenatal period. So we were getting a lot higher compliance to those mental health assessments.
Okay. And what's the result of higher compliance? If you have 4 times as many people taking it, what are you able to do with those patients then?
So the provider would then be able to address that risk factor earlier in the pregnancy, so that maybe there's a medication, maybe there's therapy, connecting to different resources, so that those situations don't get worse later in time.
Got it. Now, I learned, prepping for this interview, that you had 2 children on the platform. Could you tell me kind of what that journey was like?
So when I started at Babyscripts, I had just found out that I was pregnant, and I happened to be using one of our very first pilot OB providers, and I was able to use the program throughout my pregnancy, really understood what was healthy blood pressure, what I should be doing in certain periods of my pregnancy, really empowered me. My daughter just turned 8, and so I'm very proud to say that she's one of our first Babyscripts babies. Yeah. But over time, my second is now 5, and I was able to see that the platform changed over that period of time, and we've really progressed to be much more robust and really have more wraparound services than what we did 8-9 years ago when I was using it.
You've mentioned like blood pressure, and you've also mentioned that more recently you've gotten into mental health. What are some of the other sides of the platform? What's the experience like for an expectant mom?
So when a mom would go in and meet with her OB at her confirmation of pregnancy, she would get enrolled into Babyscripts. This would be a mobile app that she can download, and she can access really important gestation-specific information and tools. She's able to take assessments around her pregnancy risk factors, social determinants of health risk factors, and those things are triggered in different trimesters throughout her experience, and it really follows her along that prenatal and postpartum journey. And then we layer in specific content and specific assessments and tools based off of those risk factors. So if we identify that she qualifies for aspirin adherence, we put her on a specific pathway to help make sure that she's following that behavior to take low-dose aspirin throughout her pregnancy.
Gotcha. I've heard crazy numbers about the lack of OBs in the United States, let alone around the world. Talk to me about the issue of accessibility and how a virtual prenatal platform like this, kind of attacks that issue.
Sure. I mean, the March of Dimes has released reports around maternity care deserts that almost 50% of counties do not have an OBGYN.
50%,
and so
that's crazy.
Are so many areas across the country where women just don't have the access to that care. So they're driving 2 hours each way just to see an OB in the local the closest city.
Or skipping the visit altogether, I'm guessing.
Yes. And even in urban settings, getting to a provider could mean 3 buses and transferring and walking, and so it makes it very difficult. And so by using virtual tools through a smartphone or an internet-connected device, that provider is able to keep tabs on that woman even if she's not able to come in.
Yeah.
And so if they need to prescribe her antihypertensives, they're able to do that remotely without that woman necessarily coming in. So I think that there's a lot that we can do to address those maternal care deserts using technology.
Do you get to hear fun success stories?
Oh, yes. In my role in marketing, I get to tell the patient stories. I get to tell the provider stories, or success stories. We actually recently had a story covered in the New York Times this summer.
No way.
Around a patient in Louisiana who used Babyscripts and says that Babyscripts saved her life. She was much more aware about her risk factors in pregnancy. She ended up having seizures at the end of her pregnancy, but was constantly taking her blood pressure and knew it wasn't blood pressure related, knew it was something else, was brought into the hospital and has medical management of those seizures, but she really truly believes that Babyscripts is what saved her and her baby's lives.
Wow. But you said you also are the caretaker of provider stories. So what's it like? What are you hearing from the OBs?
So there's a lot of anecdotal feedback around being able to have a better picture of what's going on in their patients' lives. But also, we have research. So we recently published research last month in the Green Journal around blood pressure ascertainment. And so providers were able to get more accurate blood pressure from their patients outside of the office than in office. And so we were able to increase that blood pressure ascertainment with remote tools. But then when you look at the between black women and white women, we were able to actually completely eliminate the disparities in blood pressure ascertainment issues in the office versus outside of the office. So there's a lot that we're doing around health equity, and we get a lot of providers are really interested in using our tools to be able to just provide standard care for all of their patients and make sure that all patients have the necessary education, information, tools to really make sure that they are empowered in their pregnancy.
It's a little interesting and maybe non-intuitive that a virtual care product like that would increase standardization versus in office.
I mean, it was really surprising to see the statistics. I think that in office blood pressure ascertainment for pregnant patients was around 53%. Out of office, it went up to about 90%. Okay. And so it was a significant change in that blood pressure collection.
Okay, very nice. Last time I talked to Anish, co-founder, he talked about sort of the next big thing was this mental health push and understanding the mental well-being. As you look out another year, kind of where would you like to expand after that?
Our goal is really to put the patient at the center of their care and connect the necessary resources around her. So we unfortunately operate in a world where kind of payers and providers still can be very much siloed, especially for that patient experience. And so being able to connect the payer, the provider, the community resources, and any other stakeholder in that care through the Babyscripts platform so that when a risk is identified, it goes to the right person and that there's an intervention for that woman, and it feels like very streamlined for that woman.
Yeah.
And so that's really our goal for how we're thinking about the future of our product.
I love it. Sarah, thank you for stopping to give me an update. It's been really fun to watch the progress as the husband of a woman who had preeclampsia twice. I think about this product as truly saving people's lives, and it's just great to see where you're going next with thinking about the mental health of women after they give birth. So thanks for the update.
Thank you.
All right, take care. Keep up the good work.